A 2008 University of Missouri study found that the U.S. could face a shortage of up to 44,000 family physicians, general internists, and general pediatricians in the next 20 years. Many of these professionals operate solo or in small group practices, small businesses. It's underserved urban and rural areas such as parts of my district in Missouri. With our growing and aging population, there is an increasing demand for health care services, and there is a trend towards a coordinated and continuous care provided by primary care physicians and internists. However, during the past decade, the supply of generalist physicians has fallen by 22%, partly due to the reliance on physician specialists, which makes our health care more expensive and less efficient. The decline in generalists continues as fewer medical students are choosing to practice in family care. In addition, there is evidence that physician assistants and nurse practitioners may also be choosing to specialize in fields such as cardiology and oncology. According to the Government Accountability Office, conventional payment systems undervalue primary care compared to specialty care. There is a growing income gap between primary care physicians and specialists. Several physicians' organizations have recommended altering compensation structures to encourage medical students to become generalists. The Kaiser Family Foundation reported that in 2007, U.S. health care expenditures exceeded $7,026 per person, yet surveys on satisfaction with health care are mixed. Some experts believe that there is an over-reliance on specialists and that greater use of primary care providers and interns would lead to better outcomes at lower costs. These physicians focus on prevention, wellness, coordinated care, and chronic disease coordination. Studies show that these services can save money over the long term. I want to add a final word about health care reform. I strongly oppose employer mandates and a government-run health care system. These alternatives could cause as many as 120 million Americans to lose their current coverage, drive companies out of the market, and require substantial tax increases on the small businesses we are depending on to create jobs. I hope Congress will consider these points during our debate. And again, Madam Chair, thank you for holding this hearing. I look forward to hearing from our panel.